Atherosclerosis can be a serious pathology that develops insidiously over many years. Even patients with extensive atherosclerosis can be asymptomatic, and sudden death may be the first clinical manifestation of the disease. A normal artery wall consists of three main layers: the tunica intima, the tunica media, and the tunica adventitia. Research suggests that far from being a simple progressive process of plaque buildup and intrusion into the lumen, atherosclerosis is a complex process involving inflammatory responses. Glagov's remodeling theory suggests that during atherogenesis, lipid and cell deposition occurs within the artery wall, and the external elastic membrane remodels outward to accommodate the buildup, maintaining the size of the lumen. It's not until later stages of plaque development, where further remodeling cannot accommodate the expanding plaque, that lumen narrowing occurs. Atherosclerosis usually occurs in response to endothelial damage resulting from various factors, including dyslipidemia, smoking, hypertension, glucose intolerance, and toxins. Here we can see LDL-C migration into the injured arterial wall. The damaged endothelium induces the release of adhesion molecules, causing monocytes and T lymphocytes to migrate through the damaged intima into the subintimal space. Here, monocytes differentiate into macrophages and take up oxidized LDL-C, forming lipid-laden cells called foam cells. Proliferation and accumulation of foam cells leads to fatty streak formation. Replication of T lymphocytes and foam cells and their activation of cytokines, degradative enzymes and growth factors lead to plaque progression. These processes, along with fibrous tissue formation, lead to restructuring of the plaque and the formation of a fibrous cap. A plaque with a thin fibrous cap and substantial lipid core is at risk of rupture and is termed unstable or vulnerable. A plaque with a thick fibrous cap and smaller lipid core is regarded as less likely to rupture and is termed stable. A complicated plaque has a fibrous cap overlying a lipid-rich necrotic core. Calcification occurs to varying degrees as a plaque evolves. Atherosclerosis typically affects areas of turbulent blood flow in medium and large arteries, including the aorta, coronary, carotid and cerebral arteries, and the peripheral arteries in the legs. The signs and symptoms of atherosclerosis depend on the site of the affected artery. Stenoses causing reduced blood flow can manifest as angina, transient ischemic attacks, or intermittent claudication. If a plaque ruptures, the resulting thrombus may occlude the vessel, leading to tissue necrosis, such as myocardial infarction or stroke. Atherosclerosis may cause the vessel wall to weaken, which can result in the formation of an aneurysm. If an aortic aneurysm ruptures, the resulting hemorrhage can be fatal.